Please watch the entire operating instructions video prior to testing. The test is intended for individuals aged 14 years and older who self-collect anterior nasal swab specimens directly, or with adult-collected anterior nasal samples directly from individuals aged 2 years or older. The Flowflex Plus COVID-19 plus Flu A/B home test is intended for the qualitative detection and differentiation of SARS-CoV-2, Influenza A, and Influenza B protein antigens directly in anterior nasal swab samples from individuals with signs and symptoms of respiratory tract infection. This test is for non-prescription home use. Please read the quick reference instructions before performing the test. Wash or sanitize your hands. Make sure they are dry before starting the test. Carefully read the instructions before performing the test. Failure to follow the instructions may result in inaccurate test results. Remove the test cassette from the pouch and lay it on a clean, flat surface. Specimen collection must be done by an adult for children ages 2 to 13. Keep out of reach of children. Remove the buffer tube from the pouch. Remove the foil from the tube. Punch through the perforation on the box to form a tube holder. Place the tube in the holder. Open the swab package at the stick end. Take out the swab. Do not touch the swab tip. Gently insert the tip of the swab into one nostril. With children, insert the swab less than 3/4 of an inch. You may need to have a second person to hold the child's head while swabbing. Firmly rub the swab in a circular motion against the inside wall of the nostril 5 times. Take approximately 15 seconds to collect the specimen. Repeat this in the other nostril. Please use a face mask when swabbing others. Remove the swab from the nostril and immediately place into the buffer tube. Swirl the swab in the buffer tube for 30 seconds. Rotate the swab 5 times while squeezing the tube. Incorrect results may be observed if the swab is not swirled for 30 seconds or rotated 5 times. Remove the swab while squeezing the tube. The swab with the collected sample should be tested no more than 30 minutes after adding to the tube. Discard the swab. Attach the dropper tip and mix by swirling or flicking the bottom of the tube. Invert the buffer tube and gently squeeze 4 drops of the sample into the sample well. Discard the tube. Set the timer and read the results after 15 minutes. Do not read after 30 minutes. Individuals with impaired vision or color-impaired vision should seek help in interpretation of their test results. This test is read visually. Note, any visible faint or pink line in the test line region, COV, A, B, should be read as positive. If there is no colored line in the test region, COV, A, and/or B, and a colored line in the control line, CTL region, then that test line, COV, A, and/or B, should be read as negative. If the control CTL line is visible and has any other line or multiple lines, no matter how faint, at COV, A, and/or B appear, the test is positive for that virus. COVID-19 positive, Flu A positive, Flu B positive, Flu A plus Flu B positive, COVID-19 plus Flu A positive, COVID-19 plus Flu B positive, COVID-19, Flu A, and Flu B positive. The COVID-19, Flu A, and/or Flu B virus or viruses were detected in your sample. it is very likely that you have the respective infection or infections and are contagious. Please contact your healthcare provider or your local health authorities and follow local guidelines for self-isolation. There is a small chance that this test can give you a positive result that is incorrect, a false positive. If the control CTL line is visible, but the test COV A and or B line is not visible, the test is negative. The COVID-19 flu A or flu B virus have not been detected. If respiratory symptoms persist, seek follow-up care with a healthcare provider. If the control CTL line is not visible, even if any other line is visible in the result window, the test is not valid. Retest with a new test kit and sample. If the problem persists, call 800-838-9502 for assistance. Report your test result or results at makemytestcount.org. This voluntary and anonymous reporting helps public health teams understand COVID-19 spread in your area and across the country and informs public health decisions.